If you have ever woken up and noticed your hands appear larger than normal, ONsalus Health explains the causes of swollen hands in the morning. Poor sleeping position. Swollen hands when sleeping can be a sign of poor posture during slumber. If you put most of your weight on your side and sleep in your hands, they can swell up. What to do? Changing sleeping position may be easier said than done, but it can be aided by placing pillows between our legs, back, or wherever is appropriate for our needs. Too much sodium in the diet. Eating a diet high in salt can cause the body to retain fluid and result in your hands swelling while you sleep. What to do? You should use low sodium salt or try to impart flavour in your food via spices or other seasoning. Avoid eating foods high in salt and eliminate fast food, processed food, and other products which contain high levels of sodium. Circulatory disorder. One of the most common causes of swollen hands during sleep is poor circulation. This can become more likely as we age. The rigidity of the vessels or their obstruction can trigger circulation disorders. What to do? You'll need to go to a doctor for diagnosis and treatment, but you can support this treatment by alternating the hand we use and performing arm strengthening exercises. Additional treatments such as massage and basic health improvements can help activate circulation. Fluid retention. Another of the most common causes of swollen hands. Water retention can occur for multiple reasons. Some of these can be lifestyle related, since poor diet and a lack of exercise can influence water retention, although so too can certain health conditions. The excess water in the body causes inflammation of the tissues in the extremities, especially in the hands and feet. What to do? You will also need to go to a doctor for diagnosis, since any specific cause will need to be treated accordingly. They may recommend lifestyle changes, but they will provide clinical treatment for any underlying health condition where relevant. If you find this video useful, you can help us grow the channel by giving a super thanks. Arthritis. Arthritis is an inflammatory disease that causes pain, swelling, and stiffness in the joints. It commonly affects the joints of the hand and can cause severe inflammation. What to do? It is the doctor who will be in charge of making a diagnosis and indicating the correct treatments. This will likely require the use of anti-inflammatory analgesics to reduce swelling and treat the pain. Physiotherapy and even surgery may be required in some cases, but they will also suggest dietary and exercise changes. Carpal tunnel syndrome. This condition occurs when the median nerve that runs through the centre of the hand is compressed, causing numbness, a tingling sensation, pain, muscle weakness, and swelling in the hand. This syndrome often occurs in people who have repetitious work, such as computer users, cooks, textile workers, and many others. Whether clicking a mouse, using a knife, or carrying out any type of repetitive movement, the tissues around the carpal ligament can become inflamed and compress the median nerve. This results in swelling, as well as discomfort and pain. What to do? It is a traumatologist who will make the diagnosis and indicate the treatment to follow. This will be based on anti-inflammatory medication and corticosteroids to reduce swelling. They will likely recommend using a splint on the wrist during sleep to relieve tingling and numbness. Kidney problems. Kidney problems such as chronic kidney failure cause the organs to not work properly. Fluid retention occurs because it cannot be removed from the body through urine. Consequently, swelling of the hands occurs as well as other parts of the body. What to do? If the kidney problem is due to renal insufficiency, it must be treated by a nephrologist. After a medical evaluation, they will indicate the treatment administration needed for the underlying cause. If renal failure is severe, the use of hemodialysis may be required. Medications. Some drugs used to treat high blood pressure or diabetes, as well as steroids and birth control pills, can cause swelling in the hands when sleeping. What to do? If you are taking any of these medications, you should see your doctor to adjust the dose or change the treatment if necessary. Here is our ONsalus Health video for today. Leave a comment to let us know if you have had any of these problems with swollen hands, and we'll see you next time.